Frequently asked questions on Medicare Advantage plans. Why are they and how can they help you? Are Medicare Advantage plans good? Some seniors may find better value in Medicare Part C, called Medicare Advantage. Some plans are run by private insurance companies but regulated by the government and must offer coverage that's compatible to original Medicare Parts A and B. Most also include prescription drug coverage, which is an additional option added on called Part D for seniors who keep original Medicare. Medicare Advantage plans versus original Medicare. A Medicare Advantage managed care plan is one way to get coverage for the health care bills that Medicare doesn't pay. Medicare managed care plans are HMO or PPOs that provide basic Medicare coverage plus coverage to fill the gaps in Medicare coverage. What is a Medicare Advantage policy? Medicare Advantage plans may offer extra coverage like vision, hearing, dental, and/or health and wellness programs. Most include Medicare prescription coverage Part D. In addition to your Part B premium, you usually pay a monthly premium for the Medicare Advantage plan. Some plans do have a zero premium plan. How are Medicare Advantage plans rated? The 5-star quality rating system for Medicare Advantage plan rates Medicare Advantage plans on a scale of 1 to 5. There are different domains for MA plans versus prescription drug plans. As you can see in this diagram, original Medicare covers A, hospital, and B, doctors and medicine. Getting a Medicare Advantage plan is called C, which is a combination of A and B, plus D, which is your prescription plan. So it's a really good plan if you don't have a lot of medical problems. Who is eligible for a Medicare Advantage plan? If you are thinking about purchasing a Medicare Advantage plan, you can rest assured that you are highly likely to be accepted if you are currently covered by Medicare Parts A and B, you are within 6 months of turning 65, you are within 6 months of receiving Part B coverage if you are about to lose your group health insurance plan. Now, what this is saying there, that's your initial enrollment. Now, there's open enrollment or annual enrollment, which is October 15th to December 7th each year. Medicare Advantage plans versus PPO. What's the difference? Medicare Advantage plans are designated HMOs and require you to see a primary care doctor first. PPO plans, on the other hand, would allow you to see a specialist without a referral, but seeing an out-of-network doctor or specialist would cost you more. Most Medicare Advantage plans are either HMOs or PPOs. If you look at this diagram, the PPO allows out-of-network coverage, state or nationwide, provider network, no referrals to see specialists, and easy to use. They both may provide dental, hearing, prescription, and vision affordability. An HMO, low or no premiums, lower out-of-pocket costs, lower copays, smaller network, does not cover out-of-network. So that's the basic difference between a PPO and an HMO. A Medicare Advantage plan's a good deal. If you want a cap on your out-of-pocket health spending, Medicare Advantage has no out-of-pocket maximum. Keep that in mind. Medicare Advantage has no out-of-pocket maximum. So if you don't have a plan other than your original Medicare, you could go for quite a bit of money. You keep paying a portion of the cost of services as you use them. Medicare Advantage plans by law have an out-of-pocket maximum of no more than $6,700 per year. Once you hit that limit, the plan pays for all covered expenses. Our Medicare Advantage plans guarantee renewable. Plan benefits can change from year to year. Make sure you understand how a plan works before you join. Now, we've had the experience in our area that plans have left the area. So this is one major disadvantage of Medicare Advantage plans. How do Medicare Advantage plans make money? Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. However, each Medicare Advantage plan can charge different out of pocket costs. Each plan can also have different rules for how you get services, like whether you need a referral to see a specialist. If you have to go to doctors, facilities, or suppliers that belong to the plan for non emergency, non urgent care, these rules can change each year. How to compare Medicare Advantage plan. You want the broadest possible choice in doctors and other medical providers. More doctors and other providers accept Medicare than private Medicare Advantage insurance. Private plans tend to be restricted to a home network, like an HMO doctor in the network. If you travel frequently, you may want to consider staying with original care for this reason. Now, there are Medicare Advantage plans that allow you to use a doctor in another state or another locale if it's in their own original network. 3 important questions to ask before choosing a Medicare Advantage plan. What's my share of the cost for services and supplies? What does the plan have a network of providers for some or all categories of service? Does the plan offer benefits original Medicare doesn't cover, like vision, hearing, dental, or prescription drug coverage? Now, most Advantage plans do include the drug coverage, but your doctor or your hospital may not be in that particular plan's network. So make sure that your drugs are covered by that plan and make sure that your doctor and specialist and hospital are in their network if you choose one of those plans. Medicare Advantage plan compared versus Medicap supplements. With a Medicare Medigap supplement, you will continue to be covered by original Medicare. After Medicare has paid your claims, it will automatically forward them to your Medigap plan. The Medicare plan will then pay its portion of the bill. Medicare plans do not cover prescription drugs. Bear that in mind. They only pay the 20% that Medicare doesn't pay. It doesn't provide prescription plan. Therefore, you must also purchase a standalone Part D plan if you want drug coverage. With a Medicare Advantage plan, you continue to pay your Part B premium as usual. You may also pay an extra premium for the plan itself. You are not allowed to have a Medigap and Medicare Advantage plan simultaneously. Medicare Advantage plans typically come with deductibles and copays, but unlike original Medicare, they have an annual out-of-pocket limit. This means that once you have paid deductibles and copays that add up to the annual out-of-pocket limit, the plan will pay 100% of your medical bills for the rest of the year. So what they're saying is your maximum out-of-pocket limit could range from $4,500 to a maximum of $6,700. Medicare Advantage plan with zero premium. If you can't afford or don't want to pay additional monthly premiums, Medicare Advantage plans, like other health plans, typically charge premiums. The recent average for it was about $30 a month for an HMO or $32 to $63 for a PPO. Now, there are zero premium plans, but you have to make sure that your doctor and your hospital are in it. Medicare Advantage pros and cons. No or low premiums because your Part B premium, along with your original entitled Part A coverage, additional funds from the government, is applied to the Medicare Advantage plan. The premium can be as low as $0 to $50 per month on average. Because the monthly premiums are generally much lower, if you don't go to the doctor much or do not have any major medical concerns during the year, a Medicare Advantage plan could save you money. Doctors can choose not to accept. This is a con. Doctors can choose not to accept any or all of the Medicare Advantage plans. Even if they accept Medicare, they do not have to accept Medicare Advantage plans. These plans operate on healthcare networks, and you may have to be referred to a network provider for medical services. Another con: even if your primary care physician may accept the plan, but a referred specialist may not. Another con is Medicare Advantage has copays and deductibles in which the exact amount you pay may not be known until the months later when the paperwork has been completed and processed. Most Medicare Advantage plans have copays for almost every visit. Medicare Advantage plans under 65. If you're under 65 but have Medicare because of a disability or qualifying condition, after 2 years of disability, you may have the blanket right to buy a Medicare plan guaranteed issue at a Medicare Advantage plan. Coverage while traveling. Many plans will only pay for emergency care when you are away from your home. If you divide your time between two homes or pay extended visits to your adult children, this could pose a problem if you need some routine such as a lab test. A few plans have a national worker you can use, but you can't see this information on Medicare.gov. You will have to call the plan directly to ask about it. The plan's listing on Medicare.gov has numbers for you to call. Now, that's the service we provide. We make sure that the plan we put you in covers what you need covered. Which Medicare Advantage plan to choose? The first thing to do is make sure you are seeing all the plans in your area. Does the plan have a good star rating? What are copays, deductibles, out-of-pocket limit? Like I said, some plans have a limit of $4,500, some others go to the maximum of $6,700. If your hospital and doctors in the network is your hospital and doctors in the network list of providers, does it offer dental, vision coverage, and additional benefits? These are all things that we help you work through. Medicare Advantage plans with dental. Dental coverage through Medicare Advantage plan. You may be able to get dental coverage under some Medicare Advantage plan. Medicare Advantage plan, Medicare Part C, can include extra benefits like routine dental, routine vision, and Medicare prescription drug coverage. But be advised, the coverage is basically pretty limited. Medicare Advantage plans with dental and vision coverage. Many Advantage plans come with some dental and some vision coverage. Medicare Advantage plan with Silver Sneakers. Silver Sneakers is the premier fitness program provided at no cost by more than 60 health plans nationwide. Millions of members, thousands of gyms. Now, a lot of my clients like this feature, and it's no cost. So if that's something of interest to you, we'll make sure that we pick a plan that could include Silver Sneakers. Medicare Advantage plan with nationwide coverage. If you divide your time between two homes or pay extended visits to your adult children, this could pose a problem if you need something routine such as a lab test. A few plans offer networks you can use. Now, why did we repeat this? Because people don't realize that when they leave their local network, they might not be covered. So this is a very important question to bring up. What does Part C cover? Part C covers hospital, doctor visits, and prescription. Part C may cover vision, hearing, and dental, but on a very limited basis. Enrollment periods. If you decide to buy a Medicare Advantage plan, you must enroll between October 15 and December 7th, the period known as open enrollment, in order for your coverage to start the first of the following year. See, Medicare Advantage renews every year, unlike a supplement that's open. Original Medicare has separate enrollment periods for seniors who aren't automatically enrolled. Because of government regulations, Medicare Advantage premiums are not influenced by age, health status, or the method by which a consumer signs up, through an insurance agent, for example, or directly to an insurer. So what that's saying is it does not cost you any more to get expert advice from an agent like myself to make sure you get the best policy. Medicare Advantage lock-in period. Individuals with a Medicare Advantage plan are locked in, meaning they could only switch Medicare plans during certain times of the year unless they qualify for special circumstances, or choose to switch to a plan with a plan performance rating of 5 stars during your year, in which the plan has the 5-star overall rating, providing the individual meets other requirements to enroll. Example, living within the planned service area, as well as requirements regarding end-stage retinal disease. Take a minute and review the periods of time: the initial enrollment, general enrollment, special enrollment, full open enrollment period, and Medicare Advantage disenrollment period, because that's the only time you can get out of original Medicare Advantage plan and go back to original Medicare. What insurance company do I work for? I am an independent insurance agent. I work for you, not the insurance companies. You get the best possible rate for the most coverage. Can you purchase your coverage from us online? Definitely. We are different from other insurance agents. Most of our application enrollments are done online while you stay in the comfort of your own home. I work for you, not the insurance company. What we do is we do a shared screen, review everything with you, make sure you're comfortable with your choices, and then we do it right online. How do you contact us? My phone, 845-380-5809. Email us at insuredmeds.com. You could snail mail us to Bill Vargas, CLU, 1145 Route 55, Suite number 3, LaGrangeville, New York. Go to our website, insuredmeds.com, where we have a contact form and a lot more information and videos. What other services do you offer? Well, we offer retirement planning, life insurance, final expense insurance, and a full line of financial services. Go to our website and get a free quote, no obligation quote now. Thanks for viewing. I hope you learned a lot. Make sure that you review this video again before you make your final decision, and then let us help you get the best company. We cover all counties of New York State. Thank you. See you on the next video. Please share.